Hi guys. So today we are going to talk about different type of headache. After watching this video to the end, when next you have headache, you should be able to identify the type of headache you have. So headache are symptoms that are divided into primary headache and secondary headache. When I say something is primary, is the main problem. So primary headache is the main problem, is the main condition. It's not like there's an underlying condition somewhere that is causing the headache. No. Primary headaches are associated with genetics, poor sleep, change in brain chemical, and other things. Primary headache are three types: tension headache, migraine, and cluster type of headache. Let's take it one after the other. For tension headache, it feels as if there is a band around your head like this, just like what we are seeing here. It is associated with poor sleep and stress. Tension headache can be episodic and chronic. If it occurs less than 15 times in a month, it is episodic. If it occurs more than 15 times in a month, it is chronic. For episodic, it can be treated with painkiller, just like paracetamol or diclofenac. For the chronic one, it has to be treated with prescribed drugs like antidepressants. So let's talk about migraine. Migraine is a unilateral type of headache. When I say unilateral, it means that it affects one part of the face like this. This is one part of the face. This is another part of the face. Unilateral, one part like this. So migraine affects one part of the face like this, just like the picture we are seeing here. Migraine also happens with other symptoms like sweating, vomiting, nausea, sensitivity to light and sound. People that have migraine, they tend to stay in a dark room. Most of the time, they even close their eyes. So sensitivity to light means even normal phone brightness will affect them. It increases the pain. It makes them feel irritated. And also light, bulb, it affects them. The brightness of bulb affects them, even when it is not too bright. Migraine can be episodic or chronic also, just like tension headache. And it can also, the episodic can also be treated with just normal painkiller, while the chronic needs prescribed drugs. So lastly, let's talk about cluster headache. Cluster headache is for short period of time, just 4 hours. It is also unilateral, just like migraine. It affects this part of the face, just round the eyes like this, just like the picture we are seeing here. It mostly affects men and it is triggered by drinking alcohol. It comes with other symptoms too, which are sweating, tearing. The affected eye will be tearing, and hyperemia. Hyperemia means there is increase in blood flow to the affected eye, so it makes it appear reddish. It can also be episodic and chronic too. Like I said, the episodic can be treated with painkiller, while the chronic has to be treated with prescribed drug. So that is all for primary headache. Let's dive into secondary headache. Secondary headache are the type of headache that happens when there's an underlying condition somewhere in the body and then the headache is showing as a symptoms. Just like someone who has malaria and then they have headache. That type of headache is called secondary headache. Conditions that can cause secondary headache are malaria, high blood pressure, dehydration, brain injury, stroke, and brain tumor. When next you have headache, you should be able to tell the type of headache you have. That will be all for today's video. Bye.